I'm looking at other variables, that are responsible for this, and how are we dealing with them?
Yeah, so maybe just linking up with the question you
Yes.
asked in terms of, let's start with, you said subnationals are building airport, not fancy. But when you look at what is happening at the subnational level now, there are strong emphasis on those key elements of development: health, education. Primary health care now, if you go at the subnational level, you have a challenge even that has been introduced by the governors in terms of it's a healthy competition among the governors to see who develops his primary health care best. And so it's one of the priorities of at the subnational to strengthen primary health care. So, and if you have an improved primary health care, some of these indices around mortality, immunization, antenatal, all those ones are going to improve. And when you have an improved coverage of those basic PHC services, you're going to have a better health outcome. No. For instance, the issue of nutrition. Nutrition is such a very serious thing. When you talk of malnutrition, we are #1 in Africa. We are second in the world. That's not kind of position that we want. But like what she's saying, from utero, you have some interventions that you need to do so that the first 1,000 days of life, all the key things are provided. And then you now make sure that the child develops in terms of his cognitive development. It's not just physical or structural, but the cognitive development is very also important. And when you now have a child that is well nourished, he becomes very productive, because malnutrition also affects cognitive development of the child.
So when we know all this,
yes,
what do we do with them?
So exactly, what this HCD program now is one of the things that the government is doing. What we do is, what are those high impact interventions that needed to be done? And so the HCD, what's the HCD team, what we are trying to do is to make sure that we scrutinize the plans of each of the 36 states, look at all these components, look at their health plan, look at their education plan, look at their labor plan, and make sure that all those high impact interventions that will contribute to improvement in our human capital development are part of what they are implementing, so that they get their priorities right. That's essentially what
talking about getting priorities right, Dr. Ahmed Abdul Wahab. The standard of living is another major component, that determines HDI. You're talking about the state government and all of that, but looking at the present reality, the policies of government, targeted at, for example, the fuel subsidy removal and all of that, and then not making arrangements or adjustments in terms of wage, to be able to balance, some of these shocks that some of these policies are bringing to the economy. But do you think that we're headed in the right direction, and you think the index would improve?
Absolutely. I think we're heading into the right direction in terms of trying to prioritize what I call this high impact intervention. First, now you now find that we're putting emphasis on primary health care. If you put emphasis on primary health care, which means you are going to improve coverage of these basic services, there's something that the government is doing, the issue of the insurance. The health insurance is such that somebody can be able to access care without paying at that point of accessing care. So that what we just want, if somebody is sick, he can just walk into a facility and then he's going to be able to get the kind of care that he likes. What the government is now doing in all across the state, initially we have a national health insurance that the federal government rolled out. Now across the 36 states, you now have state health insurance agencies, and increasingly you are now having more and more number of people getting enrolled into the insurance scheme. And I think the palliative that the federal government just rolled out, I think there's a component there that I think is 1 million or so that they also want to reach in terms of making sure that they have access to insurance. And when you have insurance, I don't know, you must have experienced it. If you're on an insurance, you just walk into a facility, and at that point, you get care.
Is it about insurance or about having quality delivered? Because again, the conversation now is, revolving around what is being delivered, even when you're on this insurance. Looking at health as a case study, You go to hospitals and those on insurance don't get the maximum health care like they should get. They get substandard drugs. They don't even get drugs in some cases, and it's not covering a lot of ailments. So, I mean, how does that really work?
That's an excellent observation in terms of it's not just accessing care, is that you want to make sure that you get the quality care when you get to the hospital. So while the government is rolling out insurance, parallel to it, you also have teams or agencies that are ensured that monitors the quality of the services. This thing is not something that will happen overnight, but you also have, like for instance, if you look at Lagos State have what they call HEFAMA, or they call it HEFAMA, that actually looks at the quality of the services being rendered. And then if you have a facility, they are not happy with the standard of service that is being provided, they blacklist it. So you also have states like Yobe. Yobe also have that similar agencies. So these are best practices that not just having access to insurance, but also ensuring that the facilities actually provide standards. In fact, we have a National Health Act. The National Health Act makes a provision of a certificate of standards. That certificate of standards provides that a facility must meet certain minimum standard for it to operate. If it doesn't meet it, then you close it. So it's not just having access to any facility. So you have this issue of certificate of standard to make sure that the facilities actually they operate at a basic minimum standard.